If you have diabetes, chances are you think about your blood sugar multiple times a day. For those managing diabetes or even pre-diabetes, keeping an eye on glucose levels before and after meals is essential. But did you know that sudden spikes in blood sugar aren't always caused by food? Factors like stress, environmental changes, or even your immune system can also send your glucose levels soaring. So what can you do to lower your blood sugar fast? Stay with us. We're about to reveal 8 highly effective strategies to help you bring down blood sugar levels quickly and safely. You'll discover powerful habits that help your body burn off excess glucose, key foods and nutrients that support better insulin control, and some surprisingly simple techniques that can transform your overall health. But before we dive in, do us a quick favor, like and subscribe to support our channel, and stick around until the end to learn amazing tips. Now let's jump into how to lower blood sugar fast. When your blood sugar spikes, it means your body is struggling to process excess glucose. This condition is known as hyperglycemia, and if left unchecked, it can lead to long-term damage to your nerves, vision, and limbs. But don't worry, you can take action right now to help stabilize your blood sugar and avoid serious complications. So what are the best steps you should take immediately to bring your levels back to normal? Let's find out. 8. Get moving. Maintaining a regular exercise routine over time can help with weight management and reducing insulin resistance. But what happens inside your body during and right after a workout? Well, that depends. According to the American Diabetes Association, engaging in 30 to 45 minutes of moderate aerobic exercise daily is ideal. Activities like jogging, cycling, swimming, and dancing fall into this category. These exercises engage large muscle groups over an extended period at a moderate intensity. As your muscles work, they pull glucose from your bloodstream to fuel movement, which can lead to a noticeable drop in blood sugar immediately after exercise. However, if your goal is to lower glucose levels post-workout, you may want to steer clear of high-intensity or anaerobic exercises. These include weightlifting, high-intensity interval training, HIIT, and short sprints. Even activities like jogging, swimming, or cycling can become anaerobic if you push yourself too hard. When you engage in intense movements, your body releases stored glucose from the liver to supply energy to your muscles. As a result, anaerobic exercise may temporarily raise blood sugar levels rather than lower them. If you're simply trying to prevent a glucose spike after a meal, there's an easy solution. Go for a walk. Research has shown that a 20-minute moderate to brisk walk after eating can effectively lower blood sugar levels. In fact, walking post-meal may be even more effective than exercising beforehand. A University of Otago study in New Zealand found that participants with type 2 diabetes who took 3 10-minute walks after meals had 12% lower glucose levels than those who did a single 30-minute walk during the day. While all types of exercise contribute to better long-term glucose control, if you need to lower blood sugar quickly after a workout, stick to aerobic exercises. And to help manage post-meal spikes, take a short, refreshing walk right after you finish helping with the dishes. 7. Prioritize sleep. If you have diabetes, you may have noticed that getting a good night's sleep isn't always easy. Symptoms like hot flashes, frequent trips to the bathroom, and nighttime restlessness can make it difficult to stay asleep. Unfortunately, poor sleep can also contribute to higher blood sugar levels. A 2013 study that analyzed data from over 700,000 adults found that sleeping less than 7 hours per night increases the risk of both high blood pressure and hyperglycemia. Another study revealed that individuals who got fewer than 6 hours of sleep per night were twice as likely to develop insulin resistance. So what's the link? Staying up late can cause your body to produce excess cortisol, a stress hormone that suppresses insulin function. Research shows that elevated cortisol levels can make it harder for your body to regulate blood sugar effectively. Additionally, disrupting your natural sleep-wake cycle, especially by staying up too late, has been linked to higher insulin resistance. But if you're struggling with getting enough quality sleep, there are a few simple changes that can help. Avoid eating right before bed. Many people report feeling uncomfortable or restless when they eat too close to bedtime. Stay hydrated throughout the day, but limit caffeine intake later on. Experts recommend avoiding caffeine at least 6 hours before sleep. Skip late afternoon naps. Resting too late in the day, especially after 3 p.m., can make it harder to fall asleep at night. Exercise daily, but avoid intense workouts within 3 hours of bedtime. Prioritizing quality sleep tonight could help you avoid a blood sugar spike tomorrow. 6. Choose low GI foods. By now, you probably know that low glycemic index, GI foods, are carbohydrate-containing foods that won't cause rapid spikes in your blood sugar. On the flip side, high GI foods are typically easy to recognize. They're often packed with refined sugars and high in carbohydrates. Some of the worst offenders include white bread, French fries, sugary cereals, candies, and processed snack foods like chips and crackers. These foods lack fiber, which means they can flood your bloodstream with sugar almost instantly. On the other hand, studies show that consistently eating low GI foods can lead to a significant reduction in fasting blood sugar levels over time. But what about bringing your blood sugar down quickly? Certain low GI foods can help with that too. For example, lean meats, seafood, and healthy fats like avocados have little to no carbohydrates, but their high protein content can slow digestion, helping your body process carbs more gradually. This makes them a great choice for keeping post-meal blood sugar levels stable. Additionally, most low GI foods, such as cruciferous vegetables, whole fruits, and barley, are excellent sources of dietary fiber. Just like protein, fiber slows digestion, which means sugar enters your bloodstream at a much steadier pace. That's why meals rich in low GI, high fiber ingredients can be a powerful tool for maintaining healthy blood sugar levels after eating. 5. Keep yourself hydrated. If you've noticed that you're making more frequent trips to the bathroom, you're not alone. Frequent urination is a common sign of insulin resistance. Your body works hard to eliminate excess glucose through urine, but this process can lead to dehydration. And here's the catch. When you're dehydrated, your blood sugar levels can rise even more. The easiest fix? Drink more water. Experts suggest that diabetics should aim for around 9 to 12 glasses, or about 3 liters, of water daily. Keeping yourself hydrated helps dilute glucose in your bloodstream and supports your kidneys in flushing out excess sugar. In fact, a 2011 study on pre-diabetic individuals found that those who drank more water had lower blood sugar levels compared to those who consumed less. Beyond just lowering blood sugar, staying hydrated can also help control your appetite. Studies indicate that many people mistake thirst for hunger, leading them to snack unnecessarily when all they really need is a glass of water. In fact, drinking water before meals has been shown to reduce appetite and prevent overeating, which can help avoid unnecessary blood sugar spikes. So if you're looking for an easy and effective way to support your blood sugar levels, keep a bottle of water nearby and sip throughout the day. Sometimes the simplest habits make the biggest difference. 4. Give berberine a try. Berberine is a great compound found in several plants, and it has been a key component of Ayurvedic and traditional Chinese medicine for centuries. Although Western medicine hasn't paid much attention to this herb, recent studies suggest that berberine has a significant impact on blood sugar control. According to research published in the National Library of Medicine, type 2 diabetic participants who took 600 to 2,700 milligrams of berberine daily saw a 20% reduction in both fasting and long-term blood sugar levels. Interestingly, studies also indicate that berberine works effectively alongside common diabetes medications. But what's even more surprising is that some research suggests it may be just as effective as pharmaceutical drugs like metformin. Animal studies now show that berberine may offer multiple benefits for people with type 2 diabetes, such as boosting insulin sensitivity, enhancing insulin production, reducing glucose production in the liver, slowing the absorption of carbohydrates. So can diabetics safely use this herbal remedy? While berberine appears to be safe and can help lower blood sugar effectively, it's still essential to be mindful of your dosage. Some reports mention mild side effects, such as stomach discomfort. That's why it's always best to consult your healthcare provider before adding berberine to your daily routine. The top 4 tips are coming up next. If you're finding this video helpful, don't forget to like, share, and subscribe, and hit the bell icon so you never miss out on new diabetes health videos. Now let's dive in. 3. Take a deep breath and relax. Let's be real. Stress comes in all shapes and forms. Whether it's an illness, injury, anxiety, or even depression, stress puts a strain on your body, and can lead to chronic inflammation. And here's the problem. Chronic inflammation increases insulin resistance, making blood sugar harder to control. But it doesn't stop there. Studies show that when you're stressed, your body releases extra glucose from the liver while producing stress hormones like adrenaline, glucagon, and cortisol. And as I've mentioned before, elevated cortisol levels can make your cells less responsive to insulin, leading to higher blood sugar levels. And let's be honest, when you're overwhelmed, do you always make the healthiest food choices? Probably not. Instead of prepping a fiber-packed low-carb meal, you might grab fast food or reach for sugary snacks like ice cream or candy. Sound familiar? But here's the good news. There's a simple way to fight stress and naturally lower blood sugar. Relax. Yes, I know that's easier said than done, but hear me out. Studies have shown that mindfulness, meditation, and yoga can significantly lower stress, and in turn, help regulate your blood sugar. One study found that people who meditated regularly for 6 months saw lower blood sugar levels, improved insulin function, better overall well-being. Another study revealed that people who practiced meditation and mindfulness were 35% more likely to maintain healthy blood sugar levels than those who didn't. So, if you've been feeling on edge or restless, maybe it's time to give relaxation a real shot. Even just a few minutes of meditation or deep breathing can make a difference. Start today and help your blood sugar stay balanced tomorrow and beyond. 2. Boost your chromium and magnesium intake. Did you know that certain minerals can have a huge impact on your blood sugar? Two of the most important ones are chromium and magnesium. Both play key roles in insulin function and glucose regulation. Chromium, which is found in vegetables and grass-fed meats, helps your body manage hormones and improves insulin sensitivity. Studies suggest that it can make insulin more effective, and research even shows that chromium supplements may help lower insulin levels while improving glucose metabolism in people with type 2 diabetes. On the flip side, low chromium levels are linked to a higher risk of diabetes. In fact, studies reveal that diabetics tend to have lower chromium levels than non-diabetics, which means getting enough of this mineral is crucial. Magnesium, found in leafy greens, nuts, and seeds, plays a different but equally important role. It helps reduce inflammation, lower blood pressure, and improve glucose uptake. But here's the issue. Many diabetics lose excess magnesium through urine, leading to deficiencies. And just like with chromium, low magnesium levels are strongly associated with insulin resistance. Studies even show that supplementing with magnesium can help lower fasting blood sugar in people who are deficient. So how do you get more of these powerful minerals? You can either take supplements, though it's best to consult your doctor first, as different types of magnesium affect insulin sensitivity in different ways, or increase your intake naturally. Adding more leafy greens, legumes, whole grains, nuts, seeds, and grass-fed meats to your diet can help ensure you're getting enough of both chromium and magnesium. Small changes like these can make a big difference in your blood sugar control, so why not start today? 1. Boost your fiber intake. You've probably heard that fiber is great for blood sugar control, but have you ever wondered why? Unlike most carbohydrates, which quickly break down into glucose and trigger insulin release, fiber moves through your digestive system without significantly affecting blood sugar levels. Because it's not easily digested, fiber helps slow down the absorption of nutrients, preventing sharp spikes in glucose after meals. There are two main types of fiber, insoluble and soluble, both of which offer unique benefits. Insoluble fiber, found in foods like vegetables and legumes, supports digestion and keeps your gut healthy. Meanwhile, soluble fiber, present in oats, lentils, and whole grains, helps slow digestion, nourish gut bacteria, and regulate blood sugar more effectively. In fact, studies suggest that a fiber-rich diet can improve satiety, lower calorie intake, and reduce fasting glucose levels over time. One study even found that animals consuming 2 fiber-rich meals daily experience better post-meal glucose stability compared to those eating a low-fiber diet. And similar research on humans confirms that adding more fiber to your meals can help maintain balanced blood sugar and even lower bad LDL cholesterol. So if you're looking for a simple but powerful way to support your metabolic and cardiovascular health, Make fiber-rich foods a staple in your daily diet. We'd love to hear from you. Have any of the tips we shared been helpful for you? What methods have worked best in managing your blood sugar or improving your overall health? Join the conversation by sharing your experiences in the comments below. At Diabetes Health, our mission is to provide you with the most effective strategies to help you fight diabetes and manage your health. Don't forget to subscribe to our channel for more tips and tricks. Thanks for tuning in. We hope you're having a great day on your journey to better health.